Hello, my name is Joseph Kura. I'm the project manager of Majengo Children's Home here in Tanzania.
And I'm Simone Lee Hamilton, Executive Director of Majengo Canada, and I help develop, implement, and oversee projects in Tanzania and work with Joseph very closely.
I've been working with Simone for more than 3 years together, and we have been working more closely during this pandemic time. We had to do weekly Skype to be in touch to know everything that is happening. But during that time, we had to communicate with Dr. Reid to enforce the lockdown, which involves sanitation practice and monitoring kids' health after they come home from being away at school. From 19th March up to 24th of June, our children were in lockdown, supported by 9 dedicated staff. We had to prepare also an emergency isolated room for the children who got sick and visited the hospital. They had to be isolated for 14 days before contacting any other children. So that was a tough time and a very challenging time, but as we keep talking weekly and updating each other weekly to know exactly what is happening, it has helped us to move forward.
Yeah, things were a bit challenging at the beginning also because the government of Tanzania was saying a lot of different things than the government here in North America was saying. So we worked together to come up with the best plan. And thankfully, Dr. Reid was able to help us quite a bit as well. And once we got all the kids in lockdown and we had all the staff settled, we spent a lot of time thinking about ways we could support the community. We do a lot of work within the community around Majengo, and one thing we know is that they lack access to a lot of things, including running water and proper hygiene facilities. So we were trying to develop and think of a way that we could provide hand washing facilities to as many people as we could without having to install running water, which is how we came up with the CHECK program, which is the Coronavirus Hand Washing Emergency Kit, which was a bucket and tap system, which allowed you to fill the bucket and use the tap to wash your hands. And these kits included the tap and bucket and also included soap, masks, and then information and training on how to protect yourself from coronavirus and how to wash your hands effectively, which was done all by the staff on the ground in Tanzania. And in many cases, we provided thermometers to families that we thought would use them and need them.
Yeah, we worked really hard over a number of months to distribute this not only to our kids who are in a program, but also to vulnerable families in the community, including community at risk children and their parents, the people living with a disability. During that time, we were able to support 700 families, supplying them with soap, mask, information about hand washing, giving them thermometers. It is something that all people from the society during the pandemic time eruption, they have been told to make sure you must have a bucket at your house and you must have soap and water running. And most of the parents, most of the community, they were not afforded to purchase those kind of buckets. It's more than $6 USD to purchase one bucket. And this, most of the family, they don't even have money to buy themselves food. So this has been a time for us to see how broader we can go and help this other member from the community. So it has been a good time to see also the challenge they are facing and to try to help them as much as we can. That's what we did, but we appreciate all the supplies we did to them and all the people working real hard to make sure they receive them on time.
Yeah, there was a lot of times when making deliveries wasn't that easy. I would hear from the team that it was raining and it was muddy and they had to park kilometers away from houses to deliver the buckets. And I would get pictures of the staff up to their knees in mud delivering these buckets. But we did make sure that 700 families received these kits. And then we had to turn our minds to food, which was the next thing we were hoping to support families for. a lot of the kids, or a lot of the families of the children enrolled in our programming, especially our programming in the community, rely indirectly or directly on tourism to bring in money, which means that during the pandemic, when there was, well, still there's no tourism happening, so a lot of families were struggling to put food on the table. So we came up with a food pack, which we did in a couple of different sizes depending on the size of the family. And we distributed these to families on a monthly basis to help support their food needs.
This really helped the family because we supplied 2,940 kilograms of grain and 294 liters of oil. It also allowed them to focus on spending more time around home and less time in the village to help stop the spreading of COVID. And during that time, it was a raining season. So most of them, they didn't even have the access to go farming and to get some of the cheap labor. So most of them, they don't have the access to receive food. So with the little amount we supply to them, it helps them to sustain their life at home and help them to focus on some of the other issues which they can do around home, helping their kids who are back at school, helping their kids to treat them and to tell them how they're supposed to wash their hands, not to go around and playing with other random kids. So that helped them to help this family to use more of their time at home.
Yeah. Yeah, it was a very helpful program, and from what the team said, it was really well received every month when people got their deliveries. So it was a good thing to do. And then we turned our minds to the school issue, and something that we dealt with globally and we're dealing with here in North America, but so many kids were out of school with nothing to do. And especially in sub-Saharan Africa, the statistics show that the longer a child is out of school, the less likely they will be to go back to school. So we were concerned, especially for the kids that are in our programming outside of Majengo, about being able to get the kids back to school when school did open. So we decided to develop the Stay Home School Pack, which was essentially a booklet that we distributed. They were different for every grade. And these were designed to keep kids engaged and keep kids busy during this time, which we hoped would encourage them to return to school and keep them busy during the time when they're at home. And all of these were put together using the curriculum so that hopefully they could keep up when school actually did open again.
Yeah, our Majengo teachers went around to distribute this and help explain how to do them well, which was especially helpful to our preschool students. And we had to prepare two packages, one for English and another one for Swahili, because most of the kids, they are coming from the government primary school, which they use Swahili. Which was a little bit challenged to prepare all those kind of exam, but we did prepare it well and explain what they're supposed to do. During that time, we invested in a photocopier at the center, which allow us to create many of these booklets on site and reducing the exposure and allow us to tailor the books how we wanted and try to photocopy as many as I can to supply to the kids around the community. It helped them so much because most of the kids back home, they didn't have the access of books. They don't have the access to read. There are no time or any teacher will be around them, at least helping some of the teachers from here at the Majengo. We help them to understand the life needs to continue and they have to keep studying every day to make sure when the school are reopening, they will still be the same page like before.
Yeah, Joseph had to test his skills as a teacher to come up with Swahili curriculum books for little kids, but I think we did a good job, and I think it was really well executed on your part, and also the teachers at Majengo were really helpful. So that was another program we worked on, and then school opened in late June, and Joseph and I panicked briefly. thinking it was probably too soon for school to open safely. But unfortunately, the government said that the kids needed to go back to school. So we thought a lot about how we could support kids to return to school safely. Much like kids here go to school with hand sanitizer and with a mask, we were thinking about what we could do to help the kids that were going back to school from Majengo and also their peers, because helping a small portion of kids going back to school wouldn't really help eliminate the risk. So we were trying to find the best way to help the most children. So we came up with our SOAP program, which Joseph's going to talk about.
Yeah, during that time they reopened the school, the government ordered all the schools to have buckets and soaps. And those buckets, in each class, you're supposed to have one bucket. And most of the schools, they don't have the access of that. They don't know where they can get this bucket. They don't know where they can get these soaps. So at the time we are talking, we know the risk they are going to face, and we see how we can help them. So during that time, we end up helping 22 schools in the area, providing all the students with soap and information on hand washing. We are able to distribute 10,000 soap kits to kids of this school, ensuring that every student at school we are working with had access to soap, which is something not every parent is able to buy for their child. Most of them, the kids around our schools here, they came from vulnerable families. They come from the Maasai community, and most of them, they don't have access of soaps, access of water. So coming back to school, it was a challenge for them, and they don't know. Most of them, they don't know what is going to happen. So what we did, we go and distribute these soap kits, and we train them. We do a seminar with the teachers, do a seminar with the kids, emphasizing them to make sure they wash their hands all the time, and everyone make sure you keep your soap safe. And you can come and wash your hands all the time. You go outside all the time from the washrooms, which will help them to reduce the spreading of COVID-19 during that time.
Yeah, it was a tough project to implement, and I think Joseph and all the other staff washed their hands 10,000 times to show kids how to do it properly. But we think it was worthwhile, and hopefully played some part in making the return to school a little bit safer. So this year's been a bit challenging for us, but we definitely learned that in an emergency, we can pull together a project and implement it fairly quickly. But definitely we wouldn't have been able to do that without the generosity of our donors and our sponsors, who really stepped up this year, even though it's been so tough for so many people, and helped us make these programs a reality. The thousands of children and families that benefited from these programs are so grateful, and we're so grateful that we were able to implement them. And as we go into the end of this year and into next year, we're going to continue to focus on keeping the kids safe and helping the community in any way we can. And we're so grateful for your support.
As we continue to navigate this challenge here, we remain focused on keeping the children safe and supporting the community however we can. Simone and I will continue to work together to find the most effective ways to help the community around our area, to see their challenge they are facing and help as we can. But all this we are doing, we could have not done it without you. May God bless you all. We know during this pandemic disease, it has been affected everyone. But you guys were still there with us, helping this community, which they are facing a lot of problem all the time. But we really appreciate all the things you have been doing for us over and over again. We say thank you so much.
Yeah, thank you very much.